Our feet work so hard for us every single day, carrying us through life's many adventures, from a simple walk in the park to running a marathon. Yet, how often do we really stop to give our toenails a second glance? We might notice when the polish is chipped or when they need a trim, but we often overlook the subtle signs they might be sending us about our health. They're more than just hard surfaces at the end of our toes. They're complex structures that can reflect what's happening inside our bodies. Think of them as little windows into your overall well-being. It's important to pay attention to them. Let's shed some light on a common, often misunderstood concern. We'll explore what this fungus is, how to spot it, where it comes from, and what you can do about it. So what is this toenail fungus we're talking about? It's an infection caused by tiny, microscopic organisms called fungi. They're the same type of organisms as mushrooms, mold. They thrive in environments that are warm, dark, and moist. Your shoes can create the perfect 5-star resort for these critters. The fungus doesn't just sit on top of the nail, it works its way underneath the nail plate into the nail bed itself. Once it settles in, it begins to feed on keratin, the protein that makes up your nails, hair, and skin. When you see changes, you're seeing the fungus breaking down nail tissue, tiny invaders slowly eating away at the foundation of your toenail. That causes changes in color, texture, and shape. It's a slow, progressive process, often taking months or years to become obvious. It might start as a tiny white or yellow spot under the nail tip. If left untreated, it can spread to the entire nail and jump to neighboring toenails. Let's talk symptoms. Change in color. Yellow, brown, black spots. Thickening. Nail becomes unusually thick and hard to trim. Brittle, crumbly, ragged edges, distorted shape or lifting away from the nail bed. Onychomycosis. There may be a slight foul odor and discomfort when wearing shoes. Now that you know what toenail fungus is and what it looks like, you might be wondering, how on earth did I get this? The fungi that cause these infections are absolutely everywhere. In soil, in the air, and on many surfaces. The infection begins when your toes come into direct contact with these microscopic fungi, and they find an opportunity to get into your skin or nails. Usually through a tiny, invisible cut or a small separation between your nail and nail bed, an open door for the fungus. Think about where your feet are often bare. Public pools, locker rooms, gym showers. These are classic hotspots because they're warm and damp. Walking barefoot in these spaces is like rolling out the welcome mat for infection. Wear shower shoes or flip-flops. Your choice of footwear and socks plays a major role. Tight shoes cause minor trauma to nails. Synthetic shoes trap sweat and moisture. Wearing the same sweaty socks all day creates a personal incubator for fungus inside your shoe. Other risk factors. Age-related circulation changes, diabetes, weakened immune systems, prior athlete's foot or nail injuries. Athlete's foot can shed spores onto the floor. When you step there, those spores transfer to your feet. Simple steps like wearing shower shoes, choosing breathable materials, and rotating shoes to air out reduce risk dramatically. You might think a discolored toenail is just cosmetic. It's easy to hide it in socks and shoes and ignore it. But overlooking a fungal infection can lead to more significant problems down the road. It's progressive. The fungus will continue to damage the nail, making it thicker, distorted, and discolored. That can become painful, especially inside shoes, and can even affect how you walk. For people with diabetes or poor circulation, what starts minor can escalate into serious infections like cellulitis. Beyond physical effects, there's emotional impact. Embarrassment, avoidance of beaches or pools, lost confidence. Addressing the infection helps you reclaim comfort and confidence. Treating toenail fungus is about more than aesthetics. It's about overall health and well-being. Your feet are your foundation. Keeping them healthy keeps you active and comfortable. If you notice yellowing, thickening, or crumbling, don't panic. Take action. Schedule a visit with your doctor or a podiatrist. They can diagnose the problem. Sometimes diagnosis involves clipping the nail or testing a sample in a lab to confirm fungus. Other conditions can mimic fungus, so the right diagnosis ensures the right treatment. Treatment options include topical liquids or creams for mild cases and oral antifungal pills for advanced or stubborn infections. Oral meds work from the inside out. Nail recovery is slow. It can take many months. Patience and consistency are essential. Prevention is best. Simple steps lower your risk. Wear waterproof shower shoes or flip-flops in public locker rooms, gyms, and pools. Keep feet clean and dry thoroughly after showers, especially between the toes. Choose breathable shoes, leather or canvas, and rotate shoes so they air out between wears. Wear moisture-wicking socks, wool or good synthetic blends. Practice good nail care. Cut straight across and keep nails at a moderate length to prevent ingrowns. Be cautious at nail salons. Ensure instruments are sterilized. Treat athlete's foot promptly to stop spread to nails. Add these habits to your routine to keep your feet healthy, comfortable, and ready to go. Pay attention to early signs. A simple act of self-care that makes a huge difference over time. Thanks for watching. Like and subscribe to join our growing community of healthy humans.